Hello, my name is Rahul Thakur. I'm a GP in Rosendale and I'm also a GP with special interest in diabetes. I'm also the clinical lead for Northwest Coast Strategic Clinical Network in diabetes across Lancashire and South Cumbria, and as well as I'm working as a clinical lead within my own area and for the diabetes prevention program across Lancashire. This NHS Diabetes Prevention Program is actually a new initiative led collectively by the NHS England, Diabetes UK and Public Health England. It is a product of the NHS 5-year forward view commitment to get serious about prevention. The program was commenced with a phased national rollout in the spring 2016 with the capacity for up to 20,000 people to access this behavioral intervention program. This will roll out to the rest of the country by 2020 with an expected 100,000 referrals available each year after. There is actually a lot of evidence behind this initiative, and there's a recent systematic review and meta-analysis published by the Public Health England in 2015, I think sometime in August 2015, which examined the effectiveness of this prevention program. The review actually concluded that the behavioral interventions conducted in real-world settings are effective in reducing weight and reducing the incidence of diabetes. Overall, the incidence of diabetes was reduced by 26% over the period of around 12 to 18 months post-intervention. Well, it is actually worth doing because, as we all know, that the current prevalence of type 2 diabetes in the UK is 2.5 million, and the projected prevalence in 2030 would be more than 4 million. Currently, the NHS spending around 10% of its budget, just under £10 billion for type 2 diabetes, out of which approximately £9 billion is spent on preventable complications. Now, there are 375,000 patients who are registered in 56 practices across East Lancashire, out of which on the pre-diabetic register, which we call NDH register, is around 11,700 and something. It's close to 12,000, I would say. We have come quite far now since we met in September 2016, when the first steering group meeting actually took place in Blackburn, and there have been monthly meetings thereafter led by the FILD and YCCG. 3-year program was scheduled with around £8.5 million pumped in by the NHS England, and the provider has been named as Reed Momenta, and they are on the ball at the moment in setting up various places where the patients can go and attend this program. This program actually is a 9 months program for each patient. There are around 18 sessions, face-to-face appointment with minimum 16 hours of contact time, and it's basically a behavioral change program with goal setting and advice on diet and physical activity. And what they're going to do is basically check the blood tests and weight measurements at various points during the program. At the moment, they have started their centres in Burnley and Pendle area, and we are waiting for the other areas to refer in large numbers. And I would encourage people, families of type 2 diabetes, to get themselves checked. People who are eligible for NHS health check to get themselves checked for pre-diabetes, and then get referred if appropriate, if they get diagnosed with pre-diabetes. And I would also urge all my GP and nursing colleagues to refer these patients in large numbers.